Mr. Alessi had the unenviable job of cross-examining a medical expert, and that's often a very difficult job if you don't know what you're doing. Hi, Tony DeWitt here. I'm a Missouri appellate attorney, retired, and I bring you a fresh perspective on the law without offering any legal advice. So pull up a chair. This is what we're discussing today. For those of you who have been following along at home, you know that Mr. Alessi, generally speaking, knows what he's doing. And it's pretty obvious from this interchange that he has cross-examined medical experts before, because he starts with getting the admissions that will help his case. Let's watch.
May I, Your Honor?
Yes.
Morning, Doctor. I don't think we've had the pleasure of meeting. Welcome.
Thank you.
Sir, can you just describe, you started to do it a little bit on direct, a typical day for you?
I wake up at 4:15 in the morning. I go to my center. I set up patients with frames for their either radiosurgical procedures or stereotactic craniotomies. I go home. I make cappuccino for my wife at 6 o'clock in the morning, and then I get back to work at 6:30 and move on. I have patients that I'm operating on, and I have patients that I'm seeing through the day.
And what type of patients and what type of work? Just in a typical day. What are you doing? What type of patients and what do you do?
It varies. I mean, I see patients with brain tumors. I see patients with hydrocephalus, which is water in their brain. I see pediatric brain tumors. I see subacute and chronic subdural hematomas, post-traumatic. I see patients with strokes that are being misdiagnosed. I see patients with cancer, metastatic disease. I used to see patients with cervical problems. I stopped doing that 2 years ago. I don't know what else you want me to tell you.
No, that's great. And is that typical day, typical of the type of days you've had for the past month, past few years? Is it generally, without specifics, is it generally?
Correct.
So, none of your typical days, none of the past typical months have involved forensic pathology, have they? You haven't acted as a forensic pathologist in...
I am, you could have asked that question, very straightforward. I am not a forensic pathologist. I'm a brain surgeon.
Right. And you don't perform autopsies, correct, sir? You're a brain surgeon.
Correct. In other words, I see more brains than the forensic pathologist.
Right. And is it correct to say that the brains that you see are of living people?
Correct.
Okay, now we got to cut Mr. Alessi a little slack for the snark that he injected in there, because clearly if he was seeing mostly dead patients, he wouldn't be one heck of a neurosurgeon now, would he? But I love the way the doctor pulls the bottle down from his mouth to answer that question, like, yeah. There are funny moments in these trials that you have to kind of laugh when you get the chance, and this is one of those sort of smile-worthy moments in this trial. So then he goes into how that injury to the eye might have been caused. Then he says, isn't it true that it could have been from external forces applied to the eye? And the doctor's answer was this.
So what I'd like to do is to go to a different part of the head than was discussed, but sticking with the decedent.
Excuse me, I didn't hear the last word.
I'm sorry, the topic is going to be Mr. O'Keefe, the decedent in this matter, sir. You testified about raccoon eyes. The medical term for that, sir, is ecchymosis, right?
Correct.
And ecchymosis, raccoon eyes, does not cause a laceration to form on an eyelid, does it?
No.
Now, notice what Mr. Alessi is not doing here. He's not saying, well, what did cause that scratch on the eye? He's merely calling attention to the scratch on the eye. He's going to get to that here in just a moment. But first, he has to put up the video, or I guess the image of the face and the eye that was, I think, battered, or at the very least, was the image that has been used throughout the trial that shows the raccoon eyes, and point to the laceration on the eyelid.
Are you aware that Mr. O'Keefe had a laceration to the outside area of his right upper eyelid?
I am aware that the ME described that. Yes, sir.
Now, could, Your Honor, I'm going to, with Your Honor's permission, ask to publish what is already in evidence in a moment.
Okay.
Mr. Wolk,
What exhibit number, Mr. Alessi?
we're going to, 165, Your Honor.
Okay, go right ahead.
Thank you. Dr. Wolf, have you seen this photo depiction before today?
I believe I have.
Is it correct that that injury on the upper right eyelid is caused by the application of force directly to that area of the front of the head, again, namely the upper eyelid?
That's possible, yes.
The problem with possible is that it essentially boils down to speculative. That it could have happened doesn't mean that it did happen. So Mr. Alessi drills down a little bit further.
Is it more than possible? Is it probable that that injury was caused by the application of force directly to that area of the front of his head?
Well, an easy answer to that would be is that that's not part of the periorbital ecchymosis.
Thank you, sir. That was exactly going to be my next question.
And now we have Mr. Alessi turning the Wolfman into a pussycat, because he's just gotten him to admit that that injury to the eye doesn't relate to the fractures in the back of the head. And of course, how could it? I mean, if it doesn't, you don't hit somebody so that it leaves a scratch or a laceration on the front of your eye and have it be so strong that it actually fractures your skull and back. Nobody believes that. This is a really good example of how you get an expert to agree with you on things that matter. And that's exactly what he's doing. He's getting agreement, and he's doing it masterfully.
This injury is unrelated to any of what you've been describing, the fall backwards, the force transfer inside the skull, the, as you described it, the dura, the cerebral spinal fluid, all of that dynamic that you so ably described on your direct examination. This injury has nothing to do with that, correct?
Correct.
So the neurosurgeon says that the injury to the eye has nothing to do with the skull fractures. Now, maybe it doesn't, and maybe it does, but he has no evidence to suggest that the fall to the back of the head could have caused the eye injury, or the fall backward to the eye, to the head could have caused that. And so he's not giving an opinion on that. And that's why I say he played it straight down the middle. He didn't try to articulate some alternative possible cause. He didn't say, well, maybe a bug landed there, or maybe a stick fell out of a tree and hit his eye. He didn't do something like that, which he clearly could have done. And of course, because he looks like an expert and sounds like an expert, with the exception of his landing flaps there kind of going up a little bit on his collar. And I'm the last guy that should talk about that. Ah, man. Anyway, he obviously played it right down the middle, told the truth, and he got what he needed to get, because none of what the state got or Commonwealth got on direct examination hurts Karen Reed's case.
Thank you for answering my questions, Dr. Wolf. A pleasure again. No more questions at this time, Your Honor.
Any brief follow-up on that?
No, thank you.
All right, Dr.
Their position is there was no collision, there was no collision, there was no collision. And because there was no collision, him falling backward was not caused by anything Karen Reed did. And they can't prove that it was. Again, no blood, no tissue on the car. Now, they do have DNA on the taillight, but here's the problem with that. John rode in that car all the time. I'm sure he probably touched the taillight from time to time. And if they got a more bounteous reading than they would normally get, which is possible, then I'd have to say it was planted, because none of the injuries to that arm were caused by that taillight. None of them were, because they all are deep scratch marks, which are they look far more like dog scratches, dog bites, than they do something like a tail light slicing something in. Tail lights, if they had hit him, would have been random, and the links would have been random, but these are parallel lines. You can tell on that photo that they are parallel lines. And so, in that regard, I think Alessi did a masterful job here. One of the real problems in cross-examination is that you ask one question too many. You get all the good admissions that you want, and then you ask one more question, and it just torpedoes the entire case. And so you have to be careful about that. And because he got the answers that he wanted, he sat down. And of course, Brennan didn't want to do anything, so he said, "No, I'm done too," and the witness is going to be excused, which is a good thing, I think, probably for Dr. Wolf, as well as for Karen Reed. This guy didn't touch her. That's what I have for you today. I hope you found it helpful, interesting, or maybe both. If there's a subject you'd like me to discuss, please feel free to send me an email at the address above. If you like what we do, please feel free to subscribe and come on back to the beach tomorrow. I release videos every weekday, weather and work permitting. If you have the opportunity today, do a kindness for your fellow man. It makes the world a better place, one kind act at a time. And now, YouTube has some suggestions for other videos of mine that you might like.